Hello, I'm Dr. Kia Carter. I am a child and adolescent psychiatrist at Cook Children's Hospital. I am also the inpatient medical director for psychiatric services that a child could receive in our hospital, as well on the medical floor, which we call consultative services. I enjoy being a child psychiatrist because it helps me reach kids in a different capacity. When I went to medical school, I had the option to do pediatrics and psychiatry, and I found myself gravitating towards supporting families more, wondering what's going to happen when this child leaves the hospital. Where is mom at? How can we further give them resources? So that is kind of what's driven me to be a child psychiatrist. And I love inpatient psychiatry because I can help families when they're in a crisis, when they need help immediately. And that is something I enjoy. It is very creative. It's different every day. I don't know what I'm going to expect. And I love supporting my families that way. As a parent, if your child comes to you and tell you that they're having suicidal thoughts or just that they don't want to live anymore, the first thing you should do is remain calm. It's important to remain calm and sit down and speak with your child. Just remember, as parents, we model the behaviors that our children do. So if we overreact, if we get really upset, our child may be a little afraid to come to us next time. So as a parent, you remain calm, you sit with your child, and you ask them questions. You may want to ask them, how long have they been feeling this way? Have they spoken with anyone else about this? And do they feel safe in this moment? That's one of the most important questions we want to address, because if a child says, no, I can't be safe at this time, I want to hurt myself at this moment, then that usually requires an immediate assessment where we recommend you to come to an ER or call your pediatrician for immediate resources. If your child says, I don't want to be alive, but yes, mom, I could be safe, I can go to sleep, I can go to school tomorrow, then that is a little different. And depending on your comfort level, you may want to check on your child, but the next morning you want to make sure you do those things. Call your pediatrician, maybe contact the school counselor, and you could always bring your child to any ER for a 24-hour assessment if you're not feeling that they're safe in the home with you at that moment. So during inpatient treatment, the first thing that would happen is that you would likely get an assessment in the ER first. Most kids are admitted through the ER before they're admitted to a psychiatric unit. And that is just so that there's medical clearance. The ER doctors can make sure that they're medically clear, they don't have any medical problems, diabetes, high blood pressure, anything that we would want to address before they come to a psychiatric unit. Once you arrive to the psychiatric unit, you will meet a nurse as well as a program specialist who is able to support you and the child. You will do some paperwork that requires you to answer a lot of depth questions about your child's history, about their symptoms, about what's been happening, and then likely you will get a tour of the inpatient unit, and your child will also fill out some paperwork that they're doing that talks about their symptoms and be able to help the doctor and the treatment team. Once that happens, there's activities throughout the day. Most parents are not allowed to stay a full day with a child on an inpatient unit. Children remain safe in a safe place, and parents are usually allowed to visit maybe once or twice a day. And that's just because there's significant programming happening on an inpatient unit. They participate in group therapy, they participate in chapel groups and recreational therapy, as well as doing assessments with the psychiatrist. Most kids are admitted for about 5 to 7 days on most inpatient psychiatric units, and during that time there's a mixture of those therapies as well as family therapy and the psychiatric treatment team assessment for the best benefit of your child. So if a parent is concerned about their children's mental health, the first part is that they should stay calm. Then you want to assess for the risk. And when I say that, I mean assess if your child is having any unsafe thoughts in the moment, meaning if they're actively suicidal with a plan to hurt themselves, you want to get them the help immediately. If your child is more that they're sad or they're not feeling their normal self, you will want to contact your pediatrician or your school counselor to be able to get resources and support. Some of those places, even at school, have group therapy. They have options that kids can attend throughout the day. If your child is needing an immediate assessment where they're having active suicidal thoughts or any other imminent risk to themselves, you can always bring your child to the ER. There's always an intake worker who does a psychiatric assessment, as well as an on-call psychiatrist that they are able to communicate with to decide the best care for your child.